Welcome everyone to our Missi Education Online Health Talk by Missi Care. Today we'll talk about one of the silent killer and one of the commonest silent killer which we encounter, hypertension. We have heard a lot of people suddenly drop dead on the street or eating in a coffee shop, at home, taking shower. And we thought that all these drop dead can be because, like for example, fall sleep and fell in the toilet and knock on the head and die. Actually, most of the cases that we have encountered in the hospital, these are the cases that are not due to sleep, fell, and then knock on the head. Rather, it's bleed in the brain and then cause the patient collapse and die. And why there's a bleed in the brain, or we call it intracranial bleed. And most of the time, causes for intracranial bleed is due to uncontrolled hypertension. And we may ask why there is uncontrolled hypertension. Well, can be the patient may not know to have hypertension or is not diagnosed because hypertension most of the time may not have symptoms. Or the person know that he has hypertension but never really take initiative and the attitude towards controlling hypertension is very low and poor. Therefore, their blood pressure is not well controlled. Or the doctor treating the hypertension, they are not aggressive enough to bring the blood pressure to the optimal state. So next 20 to 15 minutes or so, you're going to explore what is hypertension, what's the definition of hypertension, when to start treatment, what are the category of medication available, and also what are the complications if it left untreated. Now, hypertension defined as a persistent high blood pressure level 140 or 90 or greater. Now, we're talking about systolic blood pressure, which is upper measurement. Diastolic blood pressure is the lower measurement. Why there are two types of measurement that we are talking about? Because systolic blood pressure is the blood pressure in the systemic blood circulation when the heart contracts. Whereas diastolic blood pressure is the measurement of the blood pressure in the systemic blood circulation when the heart relaxes. So that's why we have two types here, systolic blood pressure and diastolic blood pressure. Now, how common it is? You look at the National Health and Morbidity Survey in Malaysia 2011, it showed that those adults above 18 years old, actually with the prevalence of the high blood pressure has increased from 32.2% in 2006 to 32.7% in 2011. But as we go to the older age group to the age of 30, the prevalence, of course, has gone up from 32.2% to 42.6%. And over the years, it has gone up from 42.6% in 2006 to 43.5% in 2011. And just look at the figure in 2011 here, show 43.5%. That means every 10 person that in the room, 4 of them will have high blood pressure. That's very high figure and it's very common. And in the whole world, by WHO 2015 survey, hypertension has already affected 1.1 billion people worldwide. And this leads to a lot of issues, like for example, heart attack, stroke, vascular disease, etc. So it's estimated that by the year of 2025, we have over 1.5 billion people in the whole world will have hypertension. Now, what are the risk factors for a person to get high blood pressure? Family history, of course. If my father has high blood pressure, I stand a higher risk to get high blood pressure. If my mother and father both have high blood pressure, therefore I stand even higher risk of getting high blood pressure. So as if my sibling, my brother or sister got high blood pressure, therefore I will have a much higher risk of getting high blood pressure compared to those without those family history. Now about age. Of course, as we age, as our age grow older, as we grow older, the chance of getting high blood pressure increase as well. Because the blood vessel gradually lost its elasticity quality as we grow older. And this may eventually lead to increased blood pressure. However, don't think that only adult can get high blood pressure. In fact, there are some children have high blood pressure as well. Now, what are the difference between gender, male and female, right? Until age of 64, men are more likely to develop high blood pressure than women. But after age of 65, women are more likely to get high blood pressure. And that may be due to the postmenopause effect. The arteriosclerotic get hardened faster in female group compared to the male. Therefore, after a few years, the chance of a female getting high blood pressure is higher than male in this age group. Certain race have a higher risk of getting high blood pressure. For example, African American often develop hypertension more than other race in US, as in their studies shown. Those patients with chronic kidney diseases, we call it chronic renal failure, or newer term is called CKD, chronic kidney disease, and they have a higher chance of getting high blood pressure. So high blood pressure and CKD or chronic kidney disease is a two-way causal. Hypertension can cause chronic kidney disease. Chronic kidney disease or chronic renal failure may lead to hypertension as well, vice versa. Now, there are other risk factors which is modifiable. The one that we mentioned, we can't help because some come with family history, because of the age, because of the gender, we can't change. But certain risk factors which we can change, like for example, lack of physical activities, obesity, overweight, unhealthy diet, especially very salty food, high sodium intake, processed food, fast food, all these are very high sodium. Cumulatively, and it becomes the habitual eating habit, then a person stands very high risk of getting high blood pressure. Drinking too much of alcohol, sleep apnea, those with the obstructive sleep apnea, smoking, of course, increased risk of high blood pressure. One of the reason and mechanism is due to the hardening of the vessels. Stress lead to high blood pressure. High cholesterol level, diabetic also cause high blood pressure. As you can see that those 70% of the diabetic after 5 years of a diabetic will have hypertension. Those long-standing diabetic, 90% chance of them will get high blood pressure as well. Now, the causes of high blood pressure, we can divide into two types. One is called essential or primary, which 90% of us, 90% of those high blood pressure patients belong to this category, means that there's no causes found. And most of the time, those higher older people who got high blood pressure belong to this category. You cannot find the cause. The other type is secondary hypertension, tend to occur in the younger age group. There's a certain causes found. For example, they have the kidney problem. One of the causes is renal problem, or the vessel to the renal, artery to the renal kidney is narrow. We call it renal artery stenosis. They have a very persistent and resistant high blood pressure, very difficult to treat. Certain endocrine disorder, for example, Cushing, hyperthyroid, stand a risk of getting high blood pressure as well. Certain drugs can cause high blood pressure and other miscellaneous causes. Now, we have classified American Heart Association based on the level of blood pressure. We classify the category of hypertension. Normal adult and normal with a normal blood pressure should be systolic blood pressure less than 120, diastolic less than 80 millimeter mercury. If a person labeled as elevated high blood pressure, means that the systolic is 120 to 129, whereas diastolic is less than 80. High blood pressure stage 1, if the systolic blood pressure runs about 130 to 139, or diastolic 80 to 89. You can see from the chart here, the difference between this elevated and stage 1 is N and O. So either systolic is high, 130 to 139, or the diastolic 80 to 89, we will label this person as a stage 1 high blood pressure. High blood pressure stage 2 means that 140 or higher, or 90 or higher. It's either one or both. Hypertension crisis, there's an emergency that the doctor need to act immediately, higher than 180 or higher than 120 for diastolic blood pressure. How to diagnose it and how to treat it. So we usually use a blood pressure machine. Nowadays, we tend to see the electronic digital one. But if you go to the clinic, they still use the sphygmomanometer, where the doctor put a cuff around the arm and using the pressure measuring gauge and pumping it and look at the mercury and read from the mercury. And may have to sometimes take to 2 or 3 measurements and get the average before we decide on the level of blood pressure, especially at the beginning stage of diagnosing a person whether they have a high blood pressure. Sometimes we may ask patient to check the blood pressure at home, monitor and check it down, and look at it whether the reading at home is better compared to when they come to the clinic. Because we have to be aware that there is such phenomena called as white coat phenomena or white coat hypertension. Even though nowadays we don't wear white coat anymore, but the term still remains so. When the patient come to a clinic, they tend to be nervous, the blood pressure shoot up. But at home, the blood pressure can be normal. So in such cases, we can't label this person as hypertension patient. So home monitoring sometimes can be very useful for us to determine how well is the blood pressure is controlled and whether this person has actually high blood pressure. And certain time we may have to do certain tests, like for example, urine test, blood test, cholesterol test, ECG, X-ray, to look at the cause for the high blood pressure and also the complication and organ damage as a result of high blood pressure. Now, as you can see here, this is a typical digital blood pressure set. The first line reads systolic blood pressure. The second line reads diastolic blood pressure. The third one indicates the pulse rate. The pulse rate, whether how fast a heart pump. Now, using the artery level here, so it's a pulse rate rather than heart rate because we are not auscultating the heart. How well controlled a person or in the world generally for the blood pressure? If you look at the whole world, average the control rate of those patients known to have blood pressure, whether they're compliant to the medication or not, is another issue. But those categories that we know they have high blood pressure, the control rate varies from one country to the other country. Some can be very bad, like for example, certain part of the Africa. Even in developed country, look at the Germany and US, the control rate not even reach 1/3. So it always say that 1/3 of the high blood pressure patient, they actually don't know that they have high blood pressure. 1/3 of those on already known to have blood pressure, they are not well controlled. Then only 1/3 of those known, they're actually on medication. So it's about 1/3 theory here. And what level that we should bring the blood pressure down to? Many years ago, we look at this 1997 recommendation. They categorize even more detail. For example, general population, we should target 140/90. Those high-risk population, for example, with diabetic, we're aiming 130/85. Kidney failure problem with proteinuria less than 1 gram a day, we're targeting 130/85. But those with the kidney problem with heavy protein leak or proteinuria more than 1 gram a day, we're targeting even lower, 125/75 milligram mercury. However, as time evolves, more literature, we are changing again. Look at this chart. It's a very complicated chart, but I just want to show that different country, different continent, different part of the world have their own guideline. So as Malaysia, Europe, Africa, America, Canada. So they have a different category, different country with different category based on whether they have a diabetic or not, they have a protein leak or not, and for example, they have a kidney transplant or elderly. So look at the American Heart Association 2017 guideline. They across the board say that the target that we want to achieve is 130/80. Whereas in certain part, like in Europe, they are putting a higher range, like 140/90. Canada, more detail, they look at the proteinuria or diabetic. They have the diabetic, they are bringing down to 130/80. So a different part will have different measurement. So anything that you are not sure, you should consult your doctor. What level that my blood pressure has to be brought down to be at the safe side. Now, before talking about the medication, first, If especially the first encounter when we first diagnose a person have high blood pressure is not very high, as for example stage 1, we'll advise them, those stage 1 young don't have much risk factor, we advise them first try on lifestyle modification first. For example, exercise, get moving, focus on nutrition, cut down all the salty food, cut down the processed food, cut down your fast food, cut down the salt, no table salt. That means you go to makan your mee goreng or mee hoon soup, you can't have ketchup on the table that add into your soup. Like for example, chili padi, a lot of people like to soak the chili padi in the ketchup. Once the chili padi is soaked in the ketchup, you can't touch a chili padi. This is considered as table salt, right? So as when you eat your half-boiled egg, hypertension patients should not add soy sauce into the half-boiled egg. Check the pressure, blood pressure regularly. Lose some weight. That's one most important risk factor why a person get high blood pressure. Not only getting high blood pressure, so as obesity patient, obese patient tend to get heart problem, high cholesterol, diabetic as well. So cut down alcohol and stop smoking. Sleep well, get a good sleep, longer time sleep, and then don't take too much stress and go for vacation if possible. And if those measurements fail to achieve the good level, then we'll start using medication. Now, I have to remind you all that even those patients on medication, lifestyle modification that we mentioned just now has to be continued and continue until the blood pressure well controlled. The classification of drug they are, like for example, commonly used in the market ACE inhibitor, are those audience that have taking some blood pressure pill. You may be familiar with certain names like captopril, enalapril, lisinopril, prednisolone, and ramipril. Angiotensin antagonist, newer category compared to ACE inhibitor, ARB, rosartan, irbesartan, candesartan. Like for example, Coza, Aprovel, Atacant. Calcium channel blocker commonly used now, like felodipine, amlodipine. These are, for example, Felodendil, Velaco, Norvas, Horvas. Diuretics. Diuretics act by passing more urine through the kidney to bring down the volume of the blood in order to achieve the lower blood pressure. Thiazide group, the furosemide, high ceiling group. Potassium sparing group like spironolactone. Hydrochlorothiazide is commonly used and sometimes can combine with ARB here. Like for example, co-Aprovel, there has a Aprovel irbesartan plus hydrochlorothiazide. We have also using a beta adrenergic blocker, right? For example, beta blocker. We're talking about this is beta blocker, sorry. Like for example, propanolol, metoprolol, and atenolol. We have combination of alpha and beta blocker, labetalol, carvedilol, with pure alpha blocker, like for example, prazosin, or we call it mini-pres, terazosin, and phentermine. Some medication act centrally because some patient, especially in elderly group, their blood pressure high not only because of the weakening of the blood pressure, also poor control in the central brain area. And central acting group, they act on the brain. They control it in order to control the blood pressure. For example, clonidine, methyldopa, or aldomet. Certain is direct vasodilator, hydrazine, or minoxidil. Right. So what are the common side effects of those commonly used blood pressure? For example, diuretic, indapamide, hydrochlorothiazide. We tend to pass a lot of urine and it's quite troublesome for elderly men, especially at night. They already have the prostate problem, making them to get up very frequent to pass urine. Within medication may not be ideal. So the doctor have to be very selective and discuss with the patient whether it's suitable or not, right? And certain diuretics can exacerbate gout attack as well. Beta blocker, for example, metoprolol, atenolol, nebivolol, they cause depression, can cause fatigueness. Alpha blocker, like prazosin, sometimes it can lower the blood pressure too fast, and some patients they tend to get giddy spell. Alpha agonists which act on the brain, they may have a rebound hypertension the moment we stop or miss the dose. And because it's central acting, it that can cause some side effect like dry mouth, drowsiness. Amlodipine, diltiazem, or felodipine belongs to the calcium channel blocker group. One of the commonest side effect that we've seen is swelling of the feet. That doesn't mean because the medication cause kidney failure, heart failure, liver failure. It's not. It's just the nature of the medication itself. The other common side effect for calcium channel blocker is flushing and hotness of the face. So these are the common side effects. Angiotensin converting enzyme ACE inhibitor, lisinopril, ramipil, very common among especially Chinese. Dry cough. They have very dry, irritating cough, hacking cough. And amazingly, the moment you stop the medication, the cough can be years and months that bothering patient disappear within a week or so. So increased level of potassium. Certain ACE inhibitor will increase the potassium level and have to be careful in kidney failure patient because in kidney failure patient, the potassium problem is already high. So they have hypertension problem, sorry. So adding on the medication may complicate and increase further their potassium level, which can be fatal. Some of them will have a side effect of swelling of the lips and tongue. Can be a very serious reaction. ALB, angiotensin receptor blocker, like for example, Micardis, telmisartan, olmesartan, increase in the blood level of potassium as well. Vasodilator, for example, minoxidil, also can cause swelling of the feet. Right? Now, take-home message, one of the important take-home message is that a lot of people say, oh, don't take blood pressure pill because it can damage the kidney. Actually, this is a it's a wrong statement and can be a fatal statement. A lot of people harm other people by saying so and ask people to stop the medication, which is very bad if you to stop the medication because it can cause rebound or uncontrolled high blood pressure and cause bleed and death. So never ask anyone to stop their blood pressure if you are not a doctor. In fact, those medications that control blood pressure save life and protect kidney because they can bring down the blood pressure, control the blood pressure. Uncontrolled blood pressure is the one that causes kidney damage and is not medication. So if left uncontrolled, the kidney damage even faster. So that is the very important message. Don't simply tell people don't take blood pressure pill because it causes kidney failure. There is no such thing. In fact, blood pressure pill save kidney. Thank you.